The Healthcare Labyrinth podcast is back for another episode. Join Mark S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth podcast. My name's Mark Ryan, and it's a pleasure to be hosting the podcast. And thanks to everyone for listening in. I've written a series of blogs over the past several weeks about the predicting what might happen in the election, and also some blogs about what I think is going to happen after the election. I also just did a podcast last week about some of my predictions about healthcare policy and what we might see. And my conclusion was that notwithstanding what everyone is talking about the election being a huge mandate, and to some degree, I think that's true for the Republicans and Donald Trump. I also feel like we are still in very narrow political times. There are a lot of Democrats in Congress, a lot of Republicans, and that we probably will not see seismic changes in terms of healthcare. But we will see a diminishment, and perhaps a fairly major diminishment of coverage as the Republicans seek to extend tax cuts, and Medicaid and the ACA are probably diminished or reduced in a number of different ways. So you can go to healthcarelabyrinth.com, look at the blog site, also look at the podcast tab, so that you can sort of take a look at some of what I've said over the past several weeks and months and about what's going to happen. Today's podcast is going to be about my view that the GOP should safeguard the Affordable Care Act. I believe the Affordable Care Act saves and is a prudent investment for America. And so that's sort of the topic of the day. It builds upon some other blogs and podcasts I have done, principally related to healthcare reform. And in these earlier blogs and podcasts, I have argued that affordable universal access is absolutely key to our future in terms of healthcare costs and quality. I argued that price reform is very important because it makes things unaffordable year after year. And I also believe that pivoting from prior authorization or utilization management is critical, and getting to health, wellness, prevention, and care management is critical. Now, I happen to believe that ensuring affordable universal access and coverage in America is a necessary precursor to price reform and pivoting to care management. You need upfront care to really tackle those other two tenets of my healthcare reform. But again, you can look for those blogs and podcasts about healthcare reform, and today's podcast about protecting and safeguarding the ACA ties into those as well. So let's get started. We'll take a couple of quick breaks, and I think this will be a slightly shorter podcast than normal, but we'll break it up with those breaks. So while seismic change may not happen, if it did, how would it roll out? Well, more than likely, Donald Trump would probably recommend something along the lines of repeal and replace. And it would likely be the House GOP caucus that probably embraces it and moves a bill. The Senate, in my view, is unlikely to independently move a bill, for example, but it might end up in the upper chamber to be decided if the House were to pass it. Now, again, none of this is by any means guaranteed. On the campaign trail, the president-elect and his partner, J.D. Vance, basically tried to shy away from this subject. But at certain points, they did weigh in. And they talked about the fact that they would like to make things better and that there were some ideas that they had. I'm not sure they have a solid plan, but they did talk about it. And I would also note that GOP Speaker Mike Johnson, while he also sought to downplay repeal and replace language for the ACA, he did speak of the need for sweeping healthcare change. So, again, the president and the House might come up with some ideas to essentially repeal and replace the ACA. So, again, with Trump and Johnson and what I call the rightist Freedom Caucus potentially seeking to change things, it would really come down to, I would say, some moderates. Given the narrow margins really in both chambers, all that would need to occur is, let's say, four or so Republicans in each chamber jumping off any ACA repeal and replace bill. So, with that introduction, we're going to take our first break and we'll come back and I will start my discussion on why the GOP should not go after the Affordable Care Act. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Mark Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Mark dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Mark is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Mark's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you're enjoying this edition of the Healthcare Labyrinth podcast. We're talking about why the GOP should not go after the Affordable Care Act. So here is my Republican policy and political plea to the incoming Trump administration and the GOP Congress as to why the ACA should be safeguarded. My first point is the ACA is now popular among a majority of Americans, and that has to be something that the GOP thinks about, especially because the 2026 elections are already being talked about. The margins in the House are very tight. The margins in the Senate are very tight. And the Republicans will be basically having to defend at least 20 of 30-some states in the 2026 election. So the ACA is popular with the majority of Americans. My first point about why the ACA should not be repealed and should be safeguarded. Here's a couple stats on the popularity of the ACA. Over 21 million people are now enrolled in the exchanges, with about 24 million gaining coverage in the Medicaid expansion and related programs. So that's about 45 million Americans that have actually gained coverage due to the ACA. And when you think about friends and family, you can easily say that probably about half of the nation knows somebody that benefited from coverage either in the exchanges or in Medicaid. That's a pretty powerful number. Tens of millions, and I would say as many as 100 million more, have benefited from protections for pre-existing conditions. And I would also tell you between 150 million and 180 million have benefited from other ACA protections and coverage up to age 26 for children. So there we're getting well into a half or more of the population that has directly benefited from the ACA. And from a polling standpoint, polls are consistently showing that the overall populace supports the ACA. A Kaiser Family Foundation poll in 2024 found that Americans support the ACA 62% to 37%. About 87% of Democrats supported the ACA, 65% of independents supported the ACA. And while just 33% of Republicans supported it, that still is a sizable chunk of the Republican electorate. Let's go to our next issue. Our number 2 issue is red states benefit the most from exchange coverage. Exchange enrollment tends to be greatest in red states. In part, this is because many red states did not expand Medicaid. My assessment is that over 3/4 of the 2024 enrollment of 21.4 million is in red states or states that were swing states in 2024 and Trump won. Where red or swing states have expanded Medicaid, that would mean millions more benefited from the ACA as well. Number 3 issue, the uninsured rate is down dramatically. While we still have an uninsured problem for sure, the number of those without health care coverage is down dramatically since the ACA started in 2014. In 2010, there were more than 48 million uninsured Americans. In the first half of 2024, that was just above 25 million. This is about 7.6% of the population. So we have made great progress getting toward affordable universal access. We're not there yet. Things are not totally affordable, but at the very least, we've gotten the number of insured down below 8%. And as I said earlier, about 45 million Americans have benefited from coverage right now, either through the exchanges or the Medicaid expansion. With that, we're going to take our second break, and we'll come back to talk about a couple additional issues about why the GOP should not go after the ACA. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about why the GOP should not repeal and replace the Affordable Care Act. It's sort of my policy and political plea to keep the law in effect. So we've talked about 3 reasons that I believe we shouldn't really tamper very much with the ACA at all. Here's sort of my 4th and main reason for keeping the ACA. It's because the ACA, in my view, has reduced costs. Now, I know this is a little bit controversial, but hear me out here. So, as a recent study in Health Affairs Forefront blog found, the ACA has reduced, not increased costs, and that the country overall benefited from tens of millions getting reliable coverage. The authors of the blog dissect very well opponents' positions that the ACA drove up costs and that trimmed down benefit packages are just fine. They beat down both arguments with good statistics. GOP opponents will always point to the so-called surge in premiums in the exchanges and elsewhere for those needing individual coverage. They may be right that ACA benefits are a little bit too rich and could be reformed. But the individual market represents a very small segment of overall coverage. Opponents hate the community rating that was introduced for the exchanges, and that's basically what drives their opposition and their arguments that trimmed down benefits should be put in place and premiums surged. But what they don't tell you or don't know is that the concept, this community rating concept, is what is in place in employer coverage, and it's been around for decades. And this is what roughly half of all Americans have, employer coverage. Citing national healthcare expenditure data, the authors show that the ACA insurance expansions did not lead to accelerated cost growth as predicted. As the number of uninsured fell, the moving average of national healthcare expenditures growth decreased until COVID related spending began to come in 2020. Now, we can't really look at that COVID period for spending because a whole lot was going on. But in essence, what the authors are saying is that if you look at the trend of national healthcare expenditures in roughly, I would say, the 6 year period from 2014 to just before COVID, you actually saw lower healthcare expenditure growth annually than you did in the past. Now, admittedly, a lot could go into that, but to me, that deceleration in overall annual growth in national healthcare expenditures, I think you can argue was related to the fact that we did have better coverage for people and fewer people were uninsured. The authors argue that further coverage expansion might actually drive down cost growth even more. Admittedly, again, a lot goes into why cost increases were lower, but again, it does show that coverage expansion and affordable access does not, at the very least, lead to runaway increases even in the short term. I would have told you we would have been spending more money in the short term because we are providing subsidies for premiums and cost sharing and things like that. But in fact, these expenditure growth statistics that the authors talk about don't actually show it. You have to look at whether growth was greater or lower. And in this case, the authors show that it is indeed lower. And therefore, I think the fact that we had the ACA expand coverage really did reduce costs overall. I'm not going to argue there aren't changes we could make, but I think it's a very, very good conclusion that upfront coverage very quickly can lead to lower overall expenditures than otherwise would have been in place. With that, we're going to take our next break and we'll be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Mark Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Mark's insights. Twice a week, Mark publishes a blog to go deep into a current issue. And of course, Mark hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Mark's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about why the GOP should not go after the ACA. It's sort of my policy and political plea here. So we've talked about, I think, 4 different reasons so far. The ACA is popular among Americans. Red states benefit the most. The uninsured rate is down dramatically. And 4th, the most important one so far, was a discussion about how the ACA reduces, not increases costs. Well, the last issue I want to talk about here before we conclude is the fact that affordable universal access, in my mind, is key to future reform. Now, we don't know when reform is coming. I'm hopeful that perhaps Democrats and Republicans could get together on reform. But at the very least, my 5th tenet here about why you shouldn't touch the ACA revolves around the fact that affordable universal access is pretty much a necessary precursor to healthcare reform. In my blueprint for healthcare reform, that again you can find at the blog and podcast tabs of healthcarelabyrinth.com, I argue that America needs to focus on a few key tenets. First, forging affordable universal access, as you can expect. Second, price reform. And third, pivoting from utilization management to health, wellness, prevention, and care management. But as I've already indicated, it is really clear to me that affordable universal access is key to both of the other two tenets. Price reform and pivoting to care management will not work unless we have covered individuals that can be engaged early in their healthcare journey. In fact, it is also key to one or more of the core GOP demands in healthcare, personal responsibility as well. So, with that, those are sort of my 5 tenets of why the GOP and Donald Trump should not go after the Affordable Care Act. I'm very hopeful that they will understand the importance of the ACA to the American public and, in fact, the healthcare system, and essentially perhaps maybe forge a dialogue with Democrats so that perhaps we could take further steps down the road of healthcare reform. It's badly needed, as we know. We need to rein in costs because they're unsustainable, and we need to bring outcomes up. And we know that our outcomes are well below. They are indeed a huge outlier compared to other developed nations' healthcare systems. With that, we'll conclude this edition of the Healthcare Labyrinth podcast, and we'll see you next time. Take care.
Thanks for joining Mark and the Healthcare Labyrinth podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.